Thank you, Carla, and I want to thank the witnesses for their participation and submissions here today. I have 2 questions on testing in meat processing plants. Firstly, I understand that the meat processing plants are going to be ramping up their testing as an attempt to try and curb the spread of the virus in these settings. So we're looking at approximately 6,000 plus workers tested weekly at about €150 a test. Who's going to be responsible for the cost of these tests? Will it be the meat industry? And Mr. Healy might clarify an answer you gave earlier, and also for Mr. Carroll that question.
I can, Deputy, I mean, as I said, the testing that's now proposed to be rolled out is a public health authority-led testing and screening of facilities, initially in the 3 counties that are restricted and rolling out to the wider industry. So it's public health testing or public health-led testing.
Clarify that the cost of that will fall on the taxpayer, is that correct?
Correct, as with testing that has by and large been taking place in this country to date.
Thank you. And will the meat industry be contributing to that, Mr. Carroll? Cost of that testing?
Yeah, well, I mean, can I just say, I mean, firstly, I mean, it's just in terms of the 4 sites that are involved in the lockdown situation at the moment, we're just talking about one of them. They haven't had private testing. I think some other companies have had private testing. But in relation to the screening now that has been decided by effectively NFITs, that is going to be run by the public health authorities.
Okay, thank you. A second question is on the use of rapid diagnostic testing or rapid antigen testing. That would reduce both the response time and the cost of testing workers. If these tests were used, workers could be tested on a more frequent, almost on a daily basis. Has that method of testing been explored as an option? And if not, why not has it been looked at?
Well, I think companies have looked at that. I mean, as far as I am aware, but I can't say definitively, there hasn't been private testing amongst our members. I think in some of the secondary processing plants there has been some private testing, but it's also a case, Deputy, that the testing here is also feeding into the full rigours of the HSE track and trace system as well.
Okay, but no rapid testing has been considered. Rapid diagnostic.
As I said, there's colleagues here that may be able to talk to the testing, private testing. Paul?
Just a point, I think, on testing is that testing is part of health surveillance. It certainly has a part in the overall management of this, but the primary focus has to be on prevention and control, both in the workplace and in the wider community.
Sure, but rapid testing and a quick turnaround on testing results would find the clusters quicker.
Well, I think again we defer to the public health expertise on this, and the National Standing Oversight Committee providing their advice to NFIT on this are going down the route of serial testing as has been outlined already.
Okay, thank you. And just if I have time, Chair, a question for the Health and Safety Authority. Normally there's a hazard reporting process for employers and employees in the workplace. Are these, have you noted that these hazard reports can be submitted anonymously, and is there a formal process for following up and investigating hazard reports in the meat processing plants that you inspected?
The issue of if there has been an injury or an accident in a workplace, it has to be reported by the employer. So the employer is identified in that case, so it's not anonymised. If somebody makes a complaint, obviously we prefer when they make them with identifying themselves and the individual employer, but sometimes people don't choose to do that. So we respond appropriately if we don't have the name of an employer or we don't have the name of an individual, maybe to follow up. That's more difficult for us.
Sorry, I'm sorry to interrupt because I'm stuck for time here. I understand about notifiable incidents that have to report to the Health and Safety Authority, but in the workplace, in the meat processing plants that you inspected, 39 that were inspected, is there a process for employees to be able to anonymously submit a hazard report if they have concerns, specifically in relation to workplace practices in relation to COVID restrictions? Is that hazard process in place?
I suppose in terms of individual workplaces and indeed under the protocol, there's a number of mechanisms. There's a safety rep under the occupational health and safety legislation. There's also a lead worker rep who both can work with the worker to bring those matters to the attention, and anybody can make a complaint to the workplace contact unit which the authority runs, and we will take it from there.
I appreciate that, but just to answer the question, are you aware if there was an opportunity for employees to anonymously submit a hazard report in relation to COVID in those 39 inspections?
We would have met, I suppose what I'm in relation to those inspections, the inspector not only met with the management, let's be clear, they also met with the safety officer, the safety rep. They also took time off. 2 inspectors went into these plants as well. They were long, they were up to 3-4 hours in length, so they were very thorough, and they would also have taken the opportunity to go and speak directly to the worker in the absence of management as well.
Thank you, Chair. I might follow up with that question written to the HSE. Thank you.
Yeah,